Pancreatic cancer is one of the deadliest forms of cancer, and unfortunately, it often goes undiagnosed until it's too late. Due to its silent nature, pancreatic cancer can be difficult to detect early. However, if you are aware of the early warning signs, it can be caught in time and potentially saved through treatment. In this video, we'll explore the 5 key symptoms of pancreatic cancer that you should never ignore, starting from number 5 and working our way up to the most critical sign of all. Number 5. Jaundice. A yellow flag. Jaundice is often one of the earliest clues that something might be wrong with your pancreas, yet it's one of those symptoms that people might dismiss as something minor, like a mild skin issue. But if you notice your skin or the whites of your eyes turning a shade of yellow, don't ignore it. Your body is trying to tell you something important. Bilirubin, the substance responsible for this yellowing, is usually broken down by the liver and sent to the intestines to help digest fats. But when pancreatic cancer causes a tumor to block the bile duct, that bilirubin can't get to where it's supposed to go. Instead, it backs up into your bloodstream, creating that unmistakable yellowish tint. What's alarming is that jaundice is often a sign that the cancer is more advanced, which is why it's so crucial not to wait around. While many conditions can cause jaundice when it's linked to pancreatic cancer, it's often a warning that the disease is spreading. Imagine trying to keep a traffic jam from getting worse. If you spot the yellow flag early, it might be the difference between catching the issue before it spirals or letting it worsen. And studies have shown that people with jaundice have much lower survival rates. So if you're over 40 and notice any yellowing, even if it seems mild, take it seriously. The earlier you catch it, the better your chances of treatment. It's a simple step that could make a world of difference. Act on it. Number 4. Changes in stool and urine. Watch your poo and piss. Changes in stool and urine might seem like a strange topic to focus on, but in the case of pancreatic cancer, they can be key warning signs that shouldn't be brushed off. When the bile duct is blocked by a tumor, bile, which gives stool its typical brown color, is unable to reach the intestines. As a result, your stools may turn pale or even clay-colored, which is not only unusual but also a red flag that something's wrong inside your body. It's like a natural alarm going off, alerting you that the system isn't running as it should. And it doesn't stop there. Your urine may start to darken, often resembling the color of tea or cola. This happens because the bilirubin that normally ends up in your stool now spills over into your urine, making it look unusually dark. At first glance, these changes might seem like something minor or unrelated, but they shouldn't be ignored. If these symptoms appear suddenly or persist without explanation, it's time to see a doctor. Pancreatic cancer is notorious for causing vague symptoms, which is why it's so often diagnosed late. The appearance of pale stools and dark urine can be a sign that something deeper is going on, and addressing it sooner rather than later could make all the difference in your treatment options. It's easy to overlook these subtle changes, but paying attention to your body's signals is crucial. So if you notice anything off about your bathroom visits, especially if the changes last for more than just a day or two, don't wait, get it checked out. This small action could help catch something life-threatening early. Number 3. Persistent abdominal or back pain. A warning from within. Abdominal or back pain might not sound like the most obvious warning sign, but in the case of pancreatic cancer, it's something you definitely don't want to ignore. In the early stages, the pain may come and go, but as the cancer progresses, the discomfort tends to become more consistent and harder to shake off. The pain often starts in the upper abdomen, around the area where the pancreas sits, and can easily radiate toward your back, making it feel like your entire torso is under siege. It's like a nagging reminder that something's wrong, and if you're feeling it more and more, it's time to pay attention. What's fascinating or frustrating, depending on how you look at it, is that this pain often feels worse when you lie down, but strangely enough, it can ease when you bend forward or stand up. This unique pain pattern is due to the pancreas location just behind the stomach. It's almost like the cancer is using your body's layout to play tricks on you. If you find yourself experiencing this kind of pain, especially when it doesn't go away with typical treatments, don't brush it off. Persistent pain, particularly when it starts to interfere with your daily life, is your body's way of sounding the alarm. You owe it to yourself to get checked out. Trust your instincts, because in cases like these, early action can make all the difference in the world. Number 2. Indigestion. A sign of a deeper issue. Indigestion may seem like just another uncomfortable side effect of eating a heavy meal or dealing with stress, but when it becomes a regular, ongoing issue that doesn't seem to improve, it could signal something more serious. Chronic indigestion, also known as dyspepsia, is a common but often overlooked symptom of pancreatic cancer. Studies show that nearly 20% to 25% of pancreatic cancer patients experience digestive issues early on. This is because the pancreas plays a crucial role in breaking down food and regulating digestion. So when it's compromised, the entire digestive system suffers. Pancreatic tumors can block the bile ducts or interfere with enzyme production, leading to bloating, nausea, and a persistent feeling of fullness. Imagine eating just a bite or two of your favorite meal and feeling overly full. This is a common experience for those struggling with pancreatic issues. Along with bloating and nausea, the feeling of being stuffed even when you haven't eaten much can be incredibly frustrating. A study published in the Journal of Gastroenterology found that digestive discomfort, including indigestion, is often an early warning sign of pancreatic disorders, yet it's frequently misdiagnosed as acid reflux or IBS. If you're dealing with indigestion that keeps coming back despite trying remedies or adjusting your diet, it's time to take a deeper look at what might be causing it. It's easy to dismiss indigestion as a minor annoyance, but when it's persistent, it's worth investigating further. Early intervention is key when it comes to pancreatic cancer, as survival rates significantly improve with early detection. Addressing potential signs like these with your doctor can help you avoid a more serious outcome down the road. According to the American Cancer Society, only 10% of pancreatic cancer cases are detected in the early stages, making awareness of symptoms even more crucial. Don't let it slide, trust your body, and don't hesitate to ask for help. Number 1. Unexplained weight loss, a silent signal. Unexplained weight loss can be one of the most perplexing and concerning signs of pancreatic cancer. You might wake up one day and notice that you've dropped several pounds, even though your eating habits haven't changed and your activity levels are the same. This type of weight loss isn't something you can brush off. It's your body's way of giving you a serious heads up. Medical research indicates that about 85% of people with pancreatic cancer experience unexplained weight loss, often months before their diagnosis. Pancreatic cancer cells release chemicals into your bloodstream that disrupt the way your body processes food and turns it into energy, leading to dramatic weight loss that seems to come out of nowhere. The body begins breaking down fat and muscle at an accelerated rate, leading to rapid weight loss of 10 pounds or more in a short period. What's even more troubling is that the body's natural response to these cancer cells often results in a loss of appetite, making the weight loss even more noticeable. Some patients also develop a condition called cachexia, a severe form of muscle wasting that affects up to 80% of pancreatic cancer patients, according to the National Cancer Institute. Imagine trying to eat your regular meals, but no matter what you do, you just don't feel hungry, and the pounds keep slipping away. It's a silent signal that things aren't right inside your body. Additionally, weight loss due to pancreatic cancer is often accompanied by nutrient malabsorption, meaning your body isn't getting the essential vitamins and minerals it needs. If you've noticed any unexplained weight loss, especially when paired with other red flags like jaundice or persistent indigestion, it's time to take action. Don't let these signs go unnoticed. Early detection is crucial in treating pancreatic cancer effectively, and your doctor is your best ally in making sure you're on the right track. The 5-year survival rate for pancreatic cancer is just 12%, but with early diagnosis, the chances of successful treatment improve significantly. The key is to recognize the symptoms early and seek medical attention before it's too late. If you found this video helpful, don't forget to give it a thumbs up and share it with your loved ones, because awareness can save lives. Hit that subscribe button and turn on the notifications so you never miss out on more life-saving tips and health updates. Remember, your health matters, and it starts with staying informed. Stay tuned for more, and take care of yourselves out there.